Let's recap. Before, they just arrange it like loss of appetite, yellowish skin, itching, and fatigue. But when we now prioritize them, the signs and symptoms, we now get yellowish skin, loss of appetite, itching, and fatigue. So, nursing diagnosis for yellowish skin is because jaundice comes with a lot of things. So, the signs and symptoms of jaundice we have now is hyperthermia, and the hyperthermia must be high for you to make it the first. High temperature can actually shut down the whole system. So it is our first nursing diagnosis. We have hyperthermia related to elevated serum bilirubin level, evidenced by thermometry reading of 40 degrees Celsius. So, I told you that you don't relate something to medical diagnosis. We could have said hyperthermia related to liver cirrhosis, which the patient was having, but no, it's not correct. You have to tell us how the liver cirrhosis did or be able to the hyperthermia. You have to tell us. So, nothing no be this. Let's go to loss of appetite, which is our second, nursing diagnosis. We have imbalanced nutrition, less than body requirements related to inadequate diets, because this patient is having loss of appetite. He no go eat too much. This patient will now have imbalanced nutrition, less than body requirements related to inadequate diets or inability to process and digest nutrients, evidenced by weight loss. So you can actually relate nursing diagnosis to causes. Having formed your nursing diagnosis, the next one is nursing objective. So you have to tell us what you have in mind if you want your patient temperature to be reduced or for it to increase. In nursing care plan, you have to tell us what you want to achieve at the end of this plan you are making. So in nursing, there is to write Mr. Lacon's temperature will be reduced by 1 degree Celsius from 40 degrees Celsius to 39 degrees Celsius within 30 minutes of nursing intervention. This now brings me to the SMART method. When you want to plan this nursing care plan, when you want to plan anything in life, you have to use the SMART method. You have to be specific. Your plan has to be measurable. Your plan has to be attainable. Your plan has to be realistic and time-bound. Like, for example, if someone have weight loss, that is imbalanced nutrition, less than body requirements, you cannot tell me that patient will gain 1 kg within 30 minutes. It's not realistic. Or they are attainable, and the time bounding area, it's not this thing. Either the examiner has this person amount or this person just cram everything, but you have to show them, say you go better school by making your plan, be specific about it, use the SMART mode. So in this scenario that I gave about the hyperthermia, you saw that I said my patient's temperature will be reduced by 1 degree Celsius. That is, I am specific. No, you reduce it by 1, 2, 3, or any amount it will reduce. From 40 degrees Celsius, from my thermometry reading, to 39 degrees Celsius. Within 30 minutes, 30 minutes can't really manage this patient, and there is no how in 30 minutes it will reduce by 10 degrees Celsius or the normal. It's not realistic. So SMART mode is the goal. So let's now go into the nursing action. Nursing action now, you have to tell us, say your patient gets hyperthermia. Wetin be those things where you go do to stop this patient temperature, which you promise us that you are going to reduce the patient temperature by 1 degree Celsius within 30 minutes. You have to tell us what you are going to do. So here you are going to tell us that you will turn on the fan, or you open the window, you will do this, you will do that. Please, when doing nursing action, non-pharmacological measures comes first. If you don't cram medicine where you go use during exam, you do on your own. So you have to start with the non-pharmacological aspects, like expose your patient, fan, turn on the fan and all that, tape sponge, before you now bring in injection, usage of paracetamol injection. So pharmacological measure comes last. And please, you have to have at least five nursing action under one nursing diagnosis. If not the no be beans. Because of 9 marks, you go do all these things. So that is why you have to, did they hand on with the organization, with the uniqueness, and with the intellectual, in the care plan. You feel even because of your care plan, the examiner see this girl my own name, let me just pass this students. These students my what's up. So that's it. After you've written the nursing action, you now go to scientific rationale. So ever I am a jimara mi will quack nurse. You will not say Lisa, or you is what a nurse. Okay, scientific rationale simply means this nursing action now you carried out. You tape sponge the patient, you turn on the fan. Why? Just tell me why you did that thing. But you made that thing. Tell me, now nursing is evidence-based. If you tell me that you are going to give injection, why are you giving this paracetamol injection? What is the mode of action? Go to a CMA and reduce the temperature. You have to tell us. So in each, like you write in the aspect of this hyperthermia, you now tell us that tape sponging in nursing action, you wrote tape sponge the patients. You now tell us that tape sponging reduces the patient temperature by conduction. That is the direct contact in a water marinate feature the patient and which you now reduce the inner by conduction. The fan, the exposure, exposing the patient by convection and all that. So that is the uniqueness of nurse. Last one now is the evaluation. So in evaluation, you have to do it, all this thing I'm saying, you have to do it for all the 3 nursing diagnoses. So you derive, you have to do it for it. Go to evaluation. Yeah, you have to, look at your nursing diagnosis, the patient problem. You now look at the nursing objective, so that your patient temperature will be reduced by 1 degree Celsius from 40 degrees Celsius to 39 degrees Celsius. And the plans, do you achieve it? Was it able to reduce? Were you able to achieve these things reduce? So there, you now write, if you achieve it, you now write, Mr. Lincoln's temperature reduced by 1 degree Celsius from 40 degrees Celsius to 39 degrees Celsius within 30 minutes of nursing management. So, if you go, so no be beans. Nursing care plan, no be beans. If you write exam, nursing cancel exam and pass. One name my uncle, will bring. Even if you get 50, you try. You are very intelligent. Let me drop some tips for you. When you are writing an exam, just calm down. Forget the unnecessary pressure. Do you know, you kind of write faster and write well when you calm down. Remove that anxiety from yourself. Just do as if you are in your house. Forget say you dey inside exam hall or there is examiner. Number one, prepare well. Prepare well. Read your books. Do your best and leave the rest for God. No go kill yourself. Eat good food. Don't read too much. Maybe you have a lot of things. That is why you have to start on time and be in time. God they shall say. So don't kill yourself. You have exam tomorrow and you are reading till daybreak. How merenu brain get better? How do you want if you are the brain? If you are the brain, so you go agree follow yourself to exam. Read, rest, eat good food, and do your best and leave the rest for God. So subscribe to my YouTube channel because there are so many things I'm gonna open. So thanks for watching and see you some other time. I love you guys, most especially my returning subscribers. Mwah.